Hi, everyone. My name is Lily Schneider. Thank you for being here with us today. I'm here to introduce Senator Elizabeth Warren, who has represented Massachusetts in the U.S. Senate since 2013. A fearless advocate for the middle class, Senator Warren is one of the nation's leading progressive voices. Senator Warren has used her platform to hold some of the nation's largest corporations and most powerful government agencies accountable for fraud, waste, and abuse. As a member of the Senate committees on banking, housing, and urban affairs, finance, aging, and armed services, Senator Warren contributes legislation related to housing, the economy, Medicare and Medicaid, and advancing racial equity. We are thrilled to hear Senator Warren speak about the next steps for Black maternal health policy. Please help me welcome Senator Elizabeth Warren.
Hello. I sure wish that we could be doing this in person today, but I'm afraid we're going to have to settle for video. But I really want to thank you for hosting this conference and for inviting me to join you. Let me just get straight to it. We have a maternal mortality and morbidity crisis in America. Every year, roughly 700 pregnant people continue to die from pregnancy or delivery in the United States, making this one of only 13 countries where maternal mortality rates have worsened over the past 25 years. Alarmingly, the data show that this crisis disproportionately impacts Black and brown pregnant people. Black women are 3 times more likely than white women to die from pregnancy or childbirth-related causes, and that trend persists even after adjusting for income or education. This is an epidemic, and the COVID-19 pandemic has exacerbated these disparities. This maternal mortality and morbidity crisis is fueled by racial, ethnic, and socioeconomic inequities. It is affected by comorbidities, by inadequate access to the healthcare system, and by structural racism and discrimination. Exactly the same factors that have contributed to the substantial racial and ethnic demographic disparities in COVID-19 outcomes. On top of all that, the pandemic strained our healthcare system, and it added yet another layer of fear and vulnerability for pregnant people. This is a structural problem that requires structural solutions, and we need to hold health systems accountable. As they have so often in the past, Black women, activists, and groups are leading the way, and I stand with them. Right now, we're living in unprecedented and challenging times for our communities, for our nation, and frankly, for the entire world. We must act now to protect mothers and their families, and we must confront this crisis head on. And that is why in Congress, I've been working hard to try to do exactly that. This starts with passing the critical maternal health programs in the Momnibus, including the Maternal Health Pandemic Response Act, which I introduced with Congresswoman Lauren Underwood. Our bill would build upon common sense legislation to ensure the federal government's response to COVID-19 centers pregnant people and confronts the systemic racism and discrimination that is in our healthcare system. It includes provisions to improve data collection, research, and surveillance programs. And it also seeks to enhance public health information for pregnant people and to ensure lasting maternal health care. In addition to that, we also need to extend postpartum Medicaid coverage for a full year so moms have access to the critical care they need. Look, the way I see it, none of us is in this fight alone. And that's why I'm speaking with you today. I'm going to keep fighting tooth and nail to help ensure that parents get the support and the health care they need and they deserve. So please, keep up your great work. We're counting on you. People across the country are counting on you. We need to act now to save lives, and I am honored to be in this fight with every one of you.
Great. Well, Thank you so much to Senator Warren. It was great to hear about her amazing work, and we are excited to advocate for the future of Black maternal health policy in the U.S. As the conference comes to an end, we will lastly hear from our incredible conference leader, Dr. Amuta Onakaga, with her closing remarks. And this session can be found under the agenda tab back in the lobby. Thank you, everyone.